In April of 2008, on the one-year anniversary of the Virginia Tech shootings, Firestorm sponsored the Every Crisis is a Human Crisis National Symposium at the Georgetown University Conference Center. Dr. C. Everett Koop, the first member of Firestorm's now nationally recognized expert council, led the proceedings with his address. We are proud to have had the opportunity to learn from Dr. Koop and are pleased to share his remarks with you. Dr. C. Everett Koop was born in Brooklyn on October 14, 1916. He graduated from Dartmouth College in 1937 and received his MD degree from Cornell Medical College in 1941. Dr. Koop was appointed Deputy Assistant Secretary for Health, U.S. Public Health Service, in March of 1981. He was sworn in as Surgeon General on November 17, 1981. As Surgeon General, Dr. Koop oversaw the activities of the 6,000-member PHS Commission Corps and advised the public on health matters such as smoking and health, diet and nutrition, environmental health hazards, and the importance of immunization and disease prevention. He also became the government's chief spokesperson on AIDS. After 2 4-year terms as Surgeon General, he continued to educate the public about health issues through his writings, the electronic media, and as senior scholar of the C. Everett Koop Institute at Dartmouth. Dr. Koop was a member of a significant number of medical associations and organizations, and the recipient of numerous honors and awards, including 41 honorary doctorates. In May of 1983, Dr. Koop was awarded the Public Health Service Distinguished Service Medal in recognition of his extraordinary leadership of the U.S. Public Health Service. After his retirement, he was presented with the Surgeon General's Exemplary Service Medal and the Surgeon General's Medallion. In September of 1995, Dr. Koop was awarded the Presidential Medal of Freedom. Dr. Koop authored more than 230 articles and books on the practice of medicine and surgery, biomedical ethics, and health policy. He was awarded an Emmy in 1991 in the News and Documentary category for C. Everett Koop, M.D., a 5-part series on healthcare reform. 2 of the shows in this series were awarded Freddies in 1992, in the Best Film category of Aging for Forever Young, and in the Best Film category of Family Dynamics for Listening to Teenagers. Firestorm, along with the country, mourns the passing at his home in Hanover, New Hampshire, of Dr. Koop. Dr. Koop was 96. Dr. Koop will be remembered for his colossal contributions to the health and well-being of patients and communities in the U.S. and around the world, said a statement released by Chip Souba, Dean of the Geisel School of Medicine, and Joseph O'Donnell, Senior Scholar at the C. Everett Koop Institute. As one of our country's greatest surgeons general, he effectively promoted health and the prevention of disease, thereby improving millions of lives in our nation and across the globe. Please enjoy this presentation. Thank you.
I spent 40 years of my life treating patients one-on-one as a pediatric surgeon, and then by virtue of my role as Surgeon General, I suddenly had the oversight of 347 million people. And I knew instinctively, and then learned by experience, that prevention was a far better modality of operation than was treatment. And the best minds in public health have informed us statistically that disease treated by orthodox methods has a success rate of about 15%, Well, in the meantime, if one were to try to prevent those diseases from extending their ravages to the public, we would be up in the 76% of success, and that's a tremendous difference. And so prevention, which is the heart of public health, and the subjects we discussed today are very deeply intertwined. The first response to the scenario that I have been painting is denial. Denial by individuals of what they see, but also what they have been predicted to see. So let me remind you that the first defense in your armamentarium is personal responsibility, but that is not to say that there is not a separate thing to understand too in corporate responsibility as well. And that brings a number of considerations to the fore, which I'll just tick off. First, you all know that we don't treat mental illness in the same way that we treat physical illness. The changes we need come very slowly. Second, we have privacy laws that make it possible for mentally ill to be sheltered under the guise of, so that they are not scrutinized for the protection of the public. And I would suggest that just the way that a smoker's rights stop at the time when they infringe upon the rights of other people who don't smoke in reference to their health, that something has to be abrogated. And the deviants from normal behavior have always been with us. This is not something brand new that happened at Columbine or on 9/11. I remember as a child my mother and grandmother being volunteers in immigrant neighborhoods in New York City at settlement houses. And I remember their coming home and telling the stories about the fact that there were always incorrigible children and young people in those immigrant families. And when the Bennett Professor of Pediatrics and Chair of the Department of Pediatrics at the University of Pennsylvania noticed in a neighbor's child's behavior some of the telltale signs that he had come to know as danger signs in children, he begged the family to seek care for that child, and they denied that there was a problem and did not seek care until he had progressed to the point where he killed a Philadelphia policeman. Today, kids date younger. There is great rivalry over boyfriends and girlfriends, and in most schools, every class has its section of bullies, and the bullying is a constant problem. And that has led to several shootings, as you know, and with the press that these events get, it certainly is not over. A few minutes ago, when I mentioned surveillance, study, and diagnosis, I'm sure that some of you said, oh, what an effort that would be. But let me remind you that some cohorts in this country have already been in the position of proving the feasibility of such a system. The Commissioned Corps of the United States Public Health Service, of which Dr. Satcher and I were the commander-in-chief, but there is no such title in the Public Health Service. And we had, among other things that were laid at our doorstep, the care of federal prisons and federal prisoners. And prison administrations over the years do not seek, as far as we know, for attitude changes in the rank and file of their prisoners, but with cohorts of prisoners with a history of deviant behavior, it does pay off to watch what they're doing and to go through the surveillance system that I mentioned earlier. In addition to that, cohorts with violent behavior are even more likely to tip you off as to what the future holds if you go through that same surveillance and discussion leading to prediction and diagnosis and prevention. And while I'm speaking of words that do not seem to use as much as we did in days gone by, I want to add a word about that single word I used a few minutes ago when I said appropriate. I think appropriate is one of the great losses to our vocabulary, really, in health. If you think of all the things that are thought about and just match them against appropriateness, you'd be on the right track more often than you'd be on the wrong. And appropriate, I'd like to describe to you with an example that's a far distance from this panel. Let's say your mother weighs 250 pounds. She's been sitting in a wheelchair for the last several years. The chief reason for that is that she has very severe pain in her knees from arthritis. Now, it is possible with operations that we have today to replace those two knees, to get rid of her pain from arthritis, and to give her the opportunity to get up and walk out of that wheelchair. It is also possible to take care of her pain with a couple of injections of steroid each year. The thing is that to replace knees costs about $26,000 for each titanium replacement, and the total surgical bill and hospitalization can approach $100,000. And so that mother of yours really should not have the surgery. She should not have her knees replaced because it is not appropriate. And the reason it's not appropriate is that by sitting in a wheelchair, by weighing 250 pounds, she has already lost the will to either walk or let her muscles be trained so that she can do that. And that's what I meant when I said appropriate, and I would urge you to use it as you hear things suggested today and see if they are appropriate on the basis of good common sense that you already have. Now, probably because of the cost of replacement, when we have disasters, natural or man-made, we tend to think of buildings and bridges. And in line with what Jim has said earlier, I want to remind you that when we are talking about a disaster, we really are talking about people. They are our number one primary concern. Someone asked me one time, if you could just change one thing in public health, what would it be? Well, I didn't take a great deal of time to think over the answer, and so I said something like the following. I would like to be able to have masters of public health, doctors of public health realize that those remarkable statistics that their computers spew out represent people who hurt. As I thought about it, I probably couldn't have come up with a better answer if I'd taken the whole day to do it. Now, we emphasize the human impact of disaster, and I'm afraid most folks are still in a sense of denial, relying on some government plan to suddenly emerge that will take them off the hook. And that I don't think is out there, not at the moment anyway. And years ago, when we seemed to be a more reliant society in the United States than we are today, our more socialistic neighbors in Europe were always asking the question at times like this, when is the government going to act? And we want to turn that around and say, when are you, your company, your community going to take on your obligation and begin to act? So it comes down to the fact that we really believe that you, the individual, are your own first responder and must take on that personal responsibility. And perhaps the thing to remember in your particular walk of life, you folks out there, is that disasters affect people of every single walk of life. Now, my intent in the few minutes that I've had with you has been to lay a broad foundation for the discussion of this panel, not to give you an erudite lecture. So I think I'll just leave it at that, and I have been short enough, so there will be some time eventually for questions. Thank you very much.